Are you someone struggling with PTSD? Or maybe you know someone struggling with PTSD. Now, this can be a huge, debilitating condition. And it's going to affect everybody differently. But the main stem that it comes from is the people that have had a traumatic event. Now, when you've had this traumatic event, it causes your mind, your brain, to create neurons that you never had before. And when it creates these neurons, it causes a confusion state of mind. Because your mind goes, okay, why did this happen? This doesn't make sense. Like in my circumstance, for those who don't know me, I had a 16-month-old son die. And now he died of cancer. And when we were going through his treatment and being told that he was actually going to be okay, and then 2 weeks later he died, my mind, that doesn't happen. That reality does not happen because kids don't die before your parents. This was not a reality that I had in my life. So it caused my mind to question. It caused my mind to go into a confusion state because what had happened wasn't supposed to happen in my reality. Now, today we'll explore what PTSD is. We're going to explore its symptoms and how it affects individuals. Because I really want you to understand what's going on, right? You might have just been diagnosed with PTSD, or maybe you've had PTSD for a little while, but don't really know why or what you're going through. So I just wanted to break it down, help you to understand what your PTSD is, and begin to help you to create that life for you to create. So first thing I'm going to talk about is give you a brief explanation of what PTSD is and how it affects individuals. So PTSD is a mental health condition that can develop in a person after they've experienced or witnessed a traumatic event. Now, what this is people with PTSD have they have disturbing thoughts, feelings of related to the experience, like hypervigilance if they're in a situation that's caused their adrenaline to go really fast and then have to come down. Maybe they'll have that experience again. Now, these things, when you have PTSD, you get stuck in that place. You get stuck in those feelings of hypervigilance or not understanding, not being able to concentrate, and all these different situations are there in your mind, but you're no longer in danger. And it keeps you in this high of what's going on. It keeps you in this place of where you can go from there. Because your body is now sending you out signals saying, you're in danger, but it's just in your mind. It's not actually in the outside world. And this is one of the biggest differences that PTSD differ from other mental health causes like depression or anxiety and things like that, because it's caused by a traumatic event. Now, some of the triggers that you might be having are things like flashbacks. You might go over a situation in your mind and say, it might feel like you're seeing it again. Maybe you're reading it in books. Maybe you're watching social media. Maybe you're watching the news. And many of these traumas bring up that experience of what it felt like. And emotionally, you start to feel it again, being in that situation. So that's a flashback. And that floods your mind with images and physical sensations like you're there right back in the situation. So that's one symptom that you could have. Another one is you could have nightmares. Maybe you're always waking up in the middle of the night in that cold sweat. I've known people that have actually physically assaulted the person next to them because they've had such a bad nightmare that it's caused their body to react to the situation. What they're doing is they're replaying that event. They're replaying that event in their mind and seeing it. This happens a lot with veterans, and seeing it for the first time or in their mind and creating it again and again. And this is where problems arise. People in relationships are like, I can't be with them anymore. And this is this causes worse trauma more than the trauma that's happened. Another one is avoidance. People don't want to go back to the place that hurt them. People don't want to go back to around people. Maybe it's a relationship that they've been in. It was tough in the beginning for me because when my wife had, it was tough in the beginning for me because when my wife and I had the situation with our son, we were around each other. Luckily, we grew stronger together and it didn't draw us apart. But most times, there are relationships that break because of the situation that happened between them. And this causes that tension, and then it adds to it. It adds to the trauma in their life. Oh, great, I've gone through this experience, and now I'm not able to live my life because now this person's leaving me. Who am I? I'm not going to be able to create this life that I want. And it causes more trauma, more pain in their lives. What about hyperarousal? The easiest way to describe this is that person that's always being on guard, right? So what about hyperarousal? Now this is a pervasive mood. You have life-altering symptoms. You're quick to anger. You're irritable. You're paranoid with things that could happen. You're on guard. You're protecting yourself from that situation from happening again. What if this happens again to me? What could I do? Where could I go? When I was working in corrections, I was a correctional officer for over a decade. I would never sit with my back to the door because I'd always be prepared. What if this happened? I'd always know where the exits were. I was always on guard. I was in hypervigilance. And it caused me to always be in a stressful state. I wasn't able to figure out where I wanted to go, what to do, because I was paranoid that something could happen. I was always preparing. Once I got out of that hypervigilance started to go away. Now it doesn't matter where I sit in a restaurant. My wife could have her back to the door. I could have my back. It doesn't matter. I don't care where the exits are. I don't think things are going to happen. PTSD can affect a person's ability to work. When you have PTSD, it can cause your day-to-day activities hard to perform. Just getting up and being with your family. You become uninterested in things that you used to like. You become distant with people that you used to be close to. PTSD can affect every area of your life until you take on that control and say, look, enough is enough. I'm going to take back my life. It can cause negative thinking, changes within your thinking pattern because of the things that you've now experienced. It has changed your reality of this world. And when it changes the reality of this world, then you begin to see things a lot differently. Now, third, I want to talk to you about is triggers. What are some things that can trigger people? There are a lot of triggers out there, and I'm going to go over a bunch real quickly just to kind of let you know. Because when you bring awareness into your post-traumatic stress disorder life, you begin to get a handle on it. Because you can go, okay, why am I having these triggers? Why am I thinking this way? Who am I around? What environment am I around? What thoughts am I thinking? What things am I doing? All these different triggers can bring back emotions that were caused because of your trauma. Now, a few of them would be people, thoughts and emotions. These things, sense, smells is a big thing. Our mind is controlled by the things that we smell. Previously in my life, I used to work in a funeral home. And I don't really know if it really caused triggers within me, but when I would have a smell come in my mind, even to this day, and it's been 15 years since I've worked in a funeral home, even to this day, I can smell things and go, oh, and it brings up a vivid picture of that person that I would be dealing with in the funeral home. Because I dealt with everybody, every kind of person that you could have, suicides, murders, people that have drowned, every certain circumstance. So when I have those triggers and it pops in my mind, I go, okay, why am I thinking this? What smell? And I would be able to speak with my wife and go, wow, that smell, that reminded me of this situation. Usually sometimes she'll go, that's disgusting, don't tell me that. But, she understands. And that's what you got to begin to do. Maybe TV shows, maybe you're watching the news and a war is going on or something pops up of a car accident. And you were in a car accident, and that's your trigger. Now, this is causing you trauma because you're thinking about your car accident. but today you have to drive to work. So now you can't get in your car, which is causing your day-to-day activities to cause problems. And this is where it builds and builds and builds. What about feelings? There's people around you, they could say something or do something, and this can cause your feelings to go into a whirlwind too. Sounds, tastes, situations, maybe some situations that you've been in, these can cause problems in your mind because let's say it was a car accident that caused your trauma and someone can cut you off and this can pull you into a huge tailspin and you have to pull over, create a different feeling and say, okay, like I can't do this. Like, why did I even think I could drive somewhere? And it puts you in a bad place. So when you begin to recognize these triggers, you can begin to change your life, right? So how can you recognize triggers? Some are obvious. Others are subtle, right? In fact, you may realize or not realize that something in your life is a trigger. You're like, whoa, I didn't know that would put me off. I didn't know that being around this person that I was in a car accident with is causing me trauma in my life. I didn't know that just hearing a sound of a vehicle drive past my house causes me to rethink of that event that put me in the hospital, right? Maybe a firecracker can set off veterans because of the explosion sound. These things can really become obvious and they can really be subtle, but sometimes they don't know about it. Feelings as if you're in danger is a sign that you're experiencing a PTSD trigger. So if you're in a place and you feel and your hypervigilance comes up and you get nervous and scared, this is when you're like, okay, I need to pay attention to this. I need to figure out why I'm having this trigger. Because self-awareness will change your life. Self-awareness will help with your healing. But you need to understand that and you need to go into that self-awareness. Okay, so what are some coping strategies? I'm going to give you a few coping strategies and common treatments that they do. And not all are within therapy, but some are within yourself. So mindfulness meditation, when you can slow down, reset your mind, which is what a meditation does, it causes you to kind of be back in the here and the now, to bring an understanding to say, okay, I'm not in that situation that caused the trauma. I'm here in the present moment. I'm safe in my house. This is based on cognitive behavior therapy. That'll bring mindfulness and bring yourself back to the presence. Meditation relaxation. This can also cause different kind of resetting of the mindset. Because when you can reset your mind, you can begin the journey over again. Now, if you do breathing techniques or other kinds of meditations throughout the day, it can reset you. Sometimes you have to do it once an hour. Maybe at the beginning of every hour, you need to close your eyes, pause, do a breathing technique for a minute, and then move on with the day. And that's fine. If that's something you need to do, you need to create that within your life and create that within your lifestyle. Regaining focused thoughts through physical activity. Are you someone that because of what happened, you're now withdrawn, you're now isolating yourself and not able to do things? You need is the key word. You need to go for a walk. You need to maybe get a gym membership, go for a swim, something where your body's going to get moving. Because this builds those endorphins in your mind and can actually create positive movement in your life. Researchers from the University of Cambridge in the United Kingdom found that surfing can be an effective coping strategy for war veterans diagnosed with PTSD. There's an option if you're somewhere that you want to learn surfing. Well, I've never surfed before. Well, go learn it. Go have fun, right? That's what life's about. According to a team, a sport, being a part of other people in flow, when they're absorbed in an activity, can really create that, again, that blessing. Pets is another one. If you want to get a support dog or even a cat, something that'll help you kind of relax you and put you in a state of relaxation, this causes and can help with your PTSD symptoms. And finally, some main therapeutic treatments. I'm going to just run over these real quick. So cognitive processing therapy, which is basically the treatment encourages clients to look through thoughts differently and aim the outcome over them. So you want to rethink of the situation and reframe it into something else. Written narrative exposure. So you write down what it meant, what happened, what you're doing, and even express writing can fully help you and begin to create that life that you want. Narrative exposure therapy. So this is where you write the story based on the stressful event, and then you tell the story as it's intended to help a client understand what they went through. And then at the end, you read this and say, okay, look, you've made it through this process. You've made it to the other side. Another one would be cognitive behavior therapy. This is where they provide skills to help you identify, which is what I'm doing here. I want to give you skills to help you identify certain circumstances, situations in your life, and create that life that can truly change for you. Medications. I'm not a huge fan of medications. Medications work, but they're like a Band-Aid, right? You need to know that the medications that you use in your life are quick fixes. They're going to help you get over certain symptoms, but make sure you don't get addicted to them. Wean yourself off after a little while because you don't want to use it for the rest of your life and say, no, I need my PTSD medication. Know that you don't want to be controlled by something that happens in your life. You're in control of your life. And when you can begin to be in control of your life, this is when your life begins to shift. So I hope this gave people insight of understanding what your PTSD is, how it's going to work in your life, and how to create a life abundant with PTSD. Over the next, I come on here twice a week. So to teach and to learn. So make sure you come out, ask questions, show up, listen to my podcasts, and really grow yourself. And as always, remember, I love you all, and there's nothing you can do about it.